This is something that varies between different hospital trusts. So though NHS England has recommended that every trust before this national lockdown number 3 implemented strategies to allow partners to be present during antenatal appointments and scans, as well as labour, some of that may be changing now amongst different trusts. And there was an awful lot of campaigning about this because so many women have been suffering as a result. So many of their partners have been suffering as a result, not being able to be there. So sadly, because of the restrictions that have had to be imposed on the whole country, there will probably now be a reversal in terms of some of the antenatal appointments that your partner is able to attend and scans. But what will remain a priority is that you do have a birthing partner with you when you go into labour. Now, this may not necessarily include the induction process, which is not classed as active labour. The point at which you are 3 to 4 centimetres dilated and contracting regularly is what we class as active labour, and usually this is the stage where you are transferred to your own room, and that's where your partner can be present with you. Do be reassured from all of this that your partner can still come with you when you are in labour and at delivery. However, the point at which they are allowed will vary between different hospital trusts. Whether or not you're allowed to birth at home will again depend on your hospital trust. So many of them have had to make lots of cutbacks and restrictions, and if they haven't already, then they will probably do so over the coming weeks. And this is because we have to try and reduce the spread of COVID within our communities, but also prevent any risk to staff. So what we are trying to avoid is a potential staff member going out into the community to do a home birth and potentially contracting COVID, which then makes them unavailable to be present as part of the staff force, which we so desperately need at this time. So whether or not you are allowed a home birth is something you need to discuss with your individual trust, but the majority of them will probably be making cutbacks on that just because it may be too difficult to uphold home birth during this time. Now, individual circumstances do vary. Whether or not you're allowed a home birth medically will also depend on whether you have any underlying health conditions, whether there are any concerns in your pregnancy about yourself or your baby. So it's definitely something you need to speak to your midwife about. Now, we don't think that this is as big a risk as we initially thought, and actually the majority of studies are suggesting that vertical transmission is pretty rare. The risk of transmission is probably slightly higher perinatally, so that's at the point of birth. And the reason for that is this is the point where there could be contact through other means, so skin to skin, through blood, through feces or saliva. And we think that if a baby tests positive, it's very likely or probable that the baby probably got it at the point of birth rather than in utero. We don't know that is exactly the case, but that's what the majority of evidence appears to be suggesting. Now, having said that, the risk of transmission to the baby still remains low, and even if the baby does have coronavirus, the majority of babies are absolutely fine and do very well indeed. So again, this is something that hopefully a lot of you will take reassurance from. We also know that if you have coronavirus and you're delivered at term, so 37 weeks and above, your baby is no likelier to go and need the neonatal unit than if you didn't have coronavirus. So again, another really bit of positive news for you. The answer to this is yes. So again, there were initial concerns about whether babies could remain with their mothers when they were born, if the mother tested positive and if the mother could breastfeed. We now know that overwhelmingly, the evidence out there is that if babies are not given that initial skin-to-skin contact or are separated from their mothers, then their chance of having problems initially at feeding and with bonding increases, and also later on in life in terms of development. So it's really, really vital and important that your baby does get that skin-to-skin, and you shouldn't be afraid of that. Breastfeeding is also encouraged even if you are COVID positive, but we just also encourage you to take certain precautions. So for example, if you are sneezing or coughing, that you try and avoid doing that while you're breastfeeding, or you wear a mask as you're doing so. And if you're too poorly to breastfeed, then you could express your milk and get someone else to help to feed your baby so that you're able to still continue. Is my baby more susceptible to germs as a newborn? So there's no evidence at the moment that your baby is any more susceptible to COVID than a child who's older. The majority of babies, as I've mentioned before, who test positive for coronavirus do really, really well. What we can tell so far is that if you have coronavirus, it doesn't affect whether you should have a vaginal birth or a cesarean section. So at the moment, both options are open to women, and whether or not you have coronavirus doesn't dictate which option you go for. The only time that this may change is if you get coronavirus and develop complications. Now, depending on which gestation you're at and depending on the whole clinical picture with you and your baby, you might be advised to go for one mode above the other. But this is the same as any case where a woman may develop complications and necessitate earlier delivery. So it's something really important that your doctor will discuss with you. But in the overwhelming majority of women, even if they have coronavirus, it shouldn't affect whether they have a cesarean section or a vaginal birth. Now, the guidance has changed insofar as this has now been individualized. So the guidance now suggests that you should speak with your employer depending on your individual circumstances. Obviously, if you are someone who has underlying health conditions or who has higher risk factors, so for example, maybe slightly older or have a higher BMI, you may be more at risk, and therefore you may perhaps have alternative arrangements made in order to avoid any face-to-face contact. Certainly during this lockdown, anyone who's able to avoid face-to-face contact should stay at home and should work from home. So that applies to the entire general population. If you are pregnant, that is definitely something you need to discuss with your employer. But whereas initially our concerns were much higher, they are not so much anymore, simply because we've had a lot more reassurance with the data so far. But having said that, there will be many people who will need to take the extra precautions, and that's why this is something that you need to take up with your employer and with your GP as well, to make sure that you don't belong to the higher, more vulnerable risk groups. And in any case, if you are in the third trimester, every effort should be being made to keep you at home as much as possible. If anyone needs any further advice, then please do check out the Channel Mum Support Hub, where you'll find lots more advice and information. We will get through it. Remember, you are never ever alone, and we are here for you.